A crucial part of infertility treatments rests around the functioning of a very small gland in the neck, known as the thyroid gland. And there's been a bit of disagreement over the last years as opposed to what is considered a normal functioning thyroid for someone that is struggling to conceive. And basically, what we're starting to see are two different guidelines where what's considered normal for the general population that isn't trying to conceive, and that range of normal is a lot wider. And for patients that are struggling to conceive or have unexplained infertility, may have actually a smaller range. So a lot of patients are often told that their thyroid function is normal, and this is true for the general population. But when they're trying to conceive, that range of normal is all of a sudden much more strict and narrow. And so a lot of patients have what's called high normal levels of TSH. And TSH is a short form for thyroid stimulating hormone, a hormone produced from the pituitary gland, and it's kind of like the gas pedal in a car for the thyroid. So it's basically giving the thyroid that go signal. It's telling to make more thyroid hormone, work harder, and basically meet the requirements the body has for the levels of thyroid hormone needed. So what can start to happen is in that normal range for the general population, which is about 0.5 to 5.0 micro IU per liter, that's the unit used on blood test, is considered normal for patients in the general population. And what we're seeing now is that anything above 2.5 but still below 5 is what we call high normal TSH. So still within the normal range for the general population, but it's above that optimal range that we're seeing what's healthier for fertility and reproductive outcomes, which is 0.5 to 2.5 MIU per liter. And so we had two new research papers published in July. One of these research papers was a systematic review. They looked at over 20 clinical trials. And what they found was that having increased TSH levels, so above 2.5, one of these studies found that it was actually associated with an increased likelihood of having something called DOR, which is short for diminished ovarian reserve, so lower egg counts. And that was measured through two different tests. One is called antral follicle count on an ultrasound, and a hormone test called anti-Müllerian hormone, AMH. This is a hormone that's produced by the follicles in the ovary, so when that hormone level goes down, it's usually a reliable indicator that the egg reserve is also decreasing. So both these markers for egg reserve, the antral follicle count on ultrasound and this blood test, AMH, were actually lower for patients that had suboptimal thyroid levels. So the researchers are also, again, suggesting that patients who are trying to conceive, and particularly patients who have unexplained infertility, may actually have a higher association with elevated TSH levels or high normal TSH levels and increased likelihood of having low egg reserve. So it's important to consider this and discuss with your healthcare provider if additional screening is warranted in your case beyond just the TSH level. We also check in many cases two antibodies for the thyroid. So anti-TPO antibody and anti-thyroglobulin antibody. So both these antibodies seem to have other effects, and there's been previous research suggesting that antibodies on their own, regardless of their impact on thyroid function or thyroid hormone production, can actually damage egg quality, may impact implantation, may interact with the placenta during pregnancy. And now this newer research, this systematic review that looked at over 20 clinical trials, found that just having increased levels of these antibodies was actually associated with a significant increased risk for miscarriage, about 52% higher risk for miscarriage. Patients who had these elevated antibodies had almost a 30% decreased likelihood for embryo implantation and almost a 30% decreased likelihood for a live birth when compared to patients that had healthy or low levels for these antibodies. So basically they tested negative. So we're seeing two different scenarios here. One is when we're talking about this TSH level being in the high normal, which can occur independently of these antibodies. And these antibodies can be elevated independent of having any issues with the TSH levels or hormone levels. And in many cases they can be connected, where having antibodies can affect the TSH levels as well. So this is really like a little bit more in-depth checking and testing for thyroid function than many patients are often screened for and have a conversation regarding. And we have to pay particularly close attention to patients in two categories. One, if you have a first-degree relative that has any thyroid disorders, you're approximately 6 times more likely to have thyroid issues in your lifetime, and that may again also impact fertility negatively. And second are patients who are pregnant or in their postpartum period are actually at a higher risk of having autoimmune thyroid disease as well. And this is from a number of factors. Could be the fluctuating sex hormones, estrogen, which affects the function of the thyroid gland. It could also be related to the changes in the immune system we see during pregnancy and postpartum period. But those are two particular groups that need to have perhaps a little bit closer look at these levels, especially if there's a history of miscarriages or recurrent miscarriages.